I'm Faye. Thank you for the introduction, Kath, and Emma's here as well. She's going to present the second half of the presentation for you today. So what we wanted to talk to you about, oh, I've skipped on too early, apologies, is how we've gone about embedding sustainability into our improvement methodology at Swift. And we've been working with the Centre for Sustainable Healthcare. Ooh, thank you again. Yes, so we are an acute and community provider. We have around 5,000 staff working for us at Swift. We have a base at Warwick Hospital, but we also include Leamington Hospital and Stratford, as well as a range of community bases throughout the county. And we care for patients and our communities from Nuneaton in the north all the way to Shipston in the south. In terms of number of attendances, we have around 2,200 A&E attendances per week, about 3,000 births per annum, and around 120,000 community therapy contacts per annum. Okay, so a bit of a background and some information about us then. So we have been delivering QSIR since 2019. So QSIR is our improvement methodology, and it stands for Quality, Service Improvement and Redesign. And we use the QSIR methodology because it has a scientific base in that it uses the model for improvement as a framework that kind of underpins the whole of the programme. And QSIR itself is tailored for use in the NHS, and it draws from various improvement methodologies and provides a suite of improvement tools that we can then teach to our employees and apply to all of the different improvement work that we do. Okay, so improving quality obviously aligns with our strategy and our 4 big moves, and you can see our strategy image here and the 4 big moves that sit within that. And what you will hopefully be able to see is that that includes quality and sustainability as part of our strategic pillars. And also that one of our big moves is embedding prevention in every service. So you can see that for us, improvement is really important, and that sustainability and prevention are really high on our agenda. Our Chief Executive, Glenn Burley, advocates that improvement is everyone's business, and he sets this as an expectation for everyone within the organisation. We all need to play our part in making Swift a better place to work and providing better outcomes for our patients. So improvement methodology is in place throughout the foundation group that we work at as part of. So the foundation group is essentially a provider collaborative. We share a chief executive and a chairman of the board. And so there are 4 trusts that sit within that. And we all keep our own unique identities, but we work together to learn from each other and to share improvements across and to share resource where we need to. So of the 4 trusts that are involved in our foundation group, 3 of us use the QSIR methodology and 1 of them uses a different methodology. The important thing is that we all really focus heavily on improvement, which is really demonstrated by the improvement conference that we ran last month across the whole of the foundation group. We all came together to talk about all things improvement. So this image shows how we deliver QSIR at Swift. So we have 3 different levels of QSIR training that is provided. And that goes from an introductory level, which is just a couple of hours, which kind of introduces the basics and shows that the framework, the model for improvement framework, through to kind of really detailed face-to-face, 5 days of face-to-face accredited training. all of that based upon the QSIR methodology and the 8 QSIR modules. The QSIR content is fixed by Aqua, and that is to ensure consistent delivery of the programme across the UK. And so embedding sustainability into the content had been discussed, but the implementation of that nationally was delayed by the move from QSIR being held by NHS England to Aqua, which happened late last year. But as a trust, as I've mentioned, it was really important for us to start to think about how we can become more sustainable and how we can introduce that prevention into our improvement work. And so we decided that we would forge ahead and start some of that work ourselves. So we did take a baseline measure and had a look at of the improvement work that is taking place across the organisation, how much of that actually already has a sustainable impact predicted within it. And what we found was that currently about 62% of the improvement ideas submitted were predicted to improve some sustainability in some way. So they might not have a full sustainability focus, but there will be impacts within those ideas and those implementations that will improve things from a sustainable perspective. And we do have some plans in place to create a more robust measure so that we can set this really clear baseline, and then we can compare our progress as we continue to embed sustainability into improvement at Swift. So I'll hand you over to Emma to carry on with the presentation.
Thanks, Faye. Can you hear me okay?
Yes.
Great. Okay, so what did we do? I'm just going to go through some of the activities we did in order to improve sustainability into QSIR. So it's more of a collection of activities. We didn't really plan it to happen in this way, but these are some of the things that really contributed to us being able to have examples and have good content within our course and being able to shape that really well. So the first thing we did was to start working with the Centre for Sustainable Healthcare, and we went through their academy programme. So a group of us that work in sustainability and in improvement were coached in sustainability and improvement, and that helped us to understand those links and where we could make more crossovers between what sustainability do and what improvement do. So sustainability can have better access to improvement methodology, and we could embed, obviously, sustainability into what we do. So, okay, and then another thing we did as part of that was to have a green team competition, as Kath's already mentioned. So this is really invaluable, really, for us to have examples across the organisation of sustainability improvements that people could have. So 6 clinical teams went through the competition, which involved 9 weeks of coaching around their improvement idea that was targeted at sustainability, but also had clinical, financial and social benefits as well. So that all enabled us to have good examples in QSIR from our own organisation that we use in the content now. The other thing we did was to receive the training, again, that Kath mentioned, and kind of being able to convert some of those stats into, number of car trips and tree journeys is really impactful for kind of delivering that message that we can all, do something to support environmental outcomes. Okay. So in terms of embedding it within the content, it took quite a lot of tweaking from where we probably started. So we used some of our coaching hours from the academy in order to get that content in there, and they kind of identified a few places within our introduction and virtual levels where we could have sustainability content within them. We took that back to our faculty and we kind of discussed it and thought, actually, it probably doesn't quite fit where it was. So I think initially we have a module already called sustainability, so we kind of put it in there. But actually, when we thought about it in a bit more depth, I think it really helped to think about what we're trying to achieve and kind of just thread sustainability all the way through it. And one of the things that really helped to think was that sort of model of quality that's on the screen now. And for me, that just really helped to link sustainability into all the other parts of improvement. And it's probably where the puzzle did kind of click for me as well, in terms of how we can get sustainability within our improvement training. So now we have it within, as I said, into our virtual and our introduction programs, and we've kind of wedged it into different modules within that. So when we start to talk about quality, and we already talked about the domains of quality, we make sure we put special emphasis on sustainability, and then we give examples of different projects which have used some of those different domains of quality. So one of them might be sustainability and prevention, another one might be looking at effectiveness and efficiency. So it's just a way of dropping that thread all the way through the programme, that sustainability is something that we need to be thinking about. And it's the same for our driver diagrams, our process mapping. We just have lots of these examples now where we can just use them as an example and get that message throughout the content, that it's something to think about. And again, one of the activities that Faye just added actually into our creativity programme is around sort of using sustainability as a constraint in terms of thinking up improvement ideas. And I think I really like that as an activity, because you can show from our green teams competition examples how that really does start to, by using that constraint and focusing on environment, how that then does identify opportunities that benefit lots of other outcomes as well. So on the screen, we've just got a bit of QSIR virtual feedback as well. So I think on the previous slide, you had some of the numerical outcomes, but some of the comments we've had have been really nice as well. I won't read through all this, but hopefully you'll get this circulated afterwards. But what they've said really is that they found it encouraging to see other people's projects. It helped them to consider it within their own projects. They liked the examples, and it was well embedded. So that's again what we've been aiming to achieve, I suppose, by doing this work. So what next for us? Well, hopefully we'll start to make more contacts across the country and other QSIR faculties, so that we can share what we've already done within our virtual programme, and hopefully improve it through working together, and as well through Aqua, who run the QSIR programme. As well, we haven't really touched our practitioner programme yet, because there's a national working group being set up to update the curriculum. So hopefully we'll be able to contribute to that, and contribute our thoughts and what we've done so far as well, and hopefully shape that a bit as well. And as well, we want to be able to target people who've already been through the QSIR programme as well. So helping them to access that sustainability information through having a standalone module. And again, we use a lot of the materials that are readily available from CSH as well to be able to do that. And then ultimately, we want to be able to demonstrate whether or not this is having an impact. So we will repeat our QSIR follow-up survey. So this is something that we ask for people who've already completed the programme, and we look at what projects they've delivered, and we ask what benefits that they've had. So we will look at repeating that in sort of a time frame that will allow some of this learning to have happened, and for people to have embedded it within their projects, and see if it's having an impact on the number of projects that have at least identified sustainability is an impact that their project will have. And as well, repeating that survey that Faye's already mentioned about the number of PDSAs, and seeing how many of those have identified sustainability as a benefit, and if we can make any improvement to that. And I think that's it from us, but we'll be around at the end for any questions and comments that you might have.